So, oh god, okay, I need to hold my camera. So, this is your first video of the series. It's done pretty much after the introduction. I'm so sorry about that, but I feel that it needs to be said. So, the first thing about foster care is that the medication or the psychiatry aspect of it is completely messed up, by the way. It is so fundamentally different from how it's supposed to be in an academic sense that it's not even funny. It's not I don't mean ha ha funny either. I mean like it's just not. It is a gross, messed up. I mean completely. It's it's been it's been foobarred basically. And what I mean about this is that modern psychologists and psychiatrists believe in the least amount of care for the maximum amount of benefit, which means that you should not overdo your medication, or the best thing is to always go, as I said, least amount of care for the maximum amount of benefit. You don't go over that, you don't go under that. You find the amount of care that's needed, and you do just that amount of care, and you find the treatment that benefits you the most. In psychiatry, if you have an honest psychiatrist that's not gouging you for money, this would mean that they would find a pill that will help with comorbid disorders. One pill, not five, not 10. Like, if you have anxiety and ADHD, for example, there are pills out there that tackle both. Believe it or not, it has been done. Tara was originally developed as an antidepressant. Unfortunately, it kind of sucks as an antidepressant. It still actually works as an antidepressant. It's a low-grade antidepressant. It will, people that are on Centera report feeling happier, generally. It's just a better ADHD medication than it is um, a antidepressant. Kind of like how Viagra is a better erectile dysfunction medication than it is a heart medication. You know, whatever. But that's how modern psychologists work. They find if your medication's no longer effective, instead of upping the dosage, they switch you to a new pill. If you're not responding to pills, they'll take you off and they'll find something that works for you because you're an individual. But if you're in foster care, unfortunately, you're going to be on Medicaid or Medicare. And Medicare and Medicaid, treatment-wise, I got some pretty fucked up teeth. I just realized that. But they generally will not cover certain procedures or things, even if they're modern, new, and work. And because of that, psychiatrists are stuck with upping dosages when they should be switching pills. And because this is such a common practice in now for children, psychologists are going against what's now medically and scientifically proven to be what works the better. What this means is that newer medications, for an example, like newer antidepressants, aren't covered by Medicaid. And so them not being covered, it hurts the child because it means they can't get the best care. And if they can't get the best care, bad things tend to happen. Bad, gross things that should never happen. Like, a child can be on 5 different pills. 5 completely different pills. As an antipsychotic, an antitropic, an antidepressant, and an ADHD pill. When they really, if they were on a newer medication like even Zoloft, they would just need a Zoloft and an ADHD pill if they could get Zoloft, because surprise. That's just how that tends to work. But because the Medicaid and Medicare systems are so far behind on what needs on treatments, it results in psychologists having to upward dosages on ineffective pills. So that's one thing. That practice needs to be cut out. Another one is that the foster care agency doesn't really care. They're not advocating for you. They're advocating what's cheaper for their pockets. It is cheaper for them to stick with their Medicaid plans or Medicare plans than to pay out of pocket for their kids' treatment. Because I guarantee if you ran a foster care agency, okay, so I'm just pointing out, you're a non-profit agency. The owners of your non-profit should not be able to drive a BM fucking W. Take the money that they're getting for the BM fucking W's and their 50 house rooms and whatever the hell else. Because I'm thinking of some non-profits that are Fortune 500 companies. You cannot tell me that they can't afford to pay to give their kids proper treatment and care. They can. If they can pay to expand their operations and pay for properties and things like that, they can afford to say, oh, we don't need an outpost here. What we do need is to make sure little Jimmy over there doesn't die of fucking cancer. That's an extreme example because I'm talking about their... But yeah, their treatment options in general are just shitty. And this results in many foster kids dying from misuse of medications. Even like if you're taking 5 different medications for your behavior problems, statistically speaking, you can die. You can those medications can one day have a reaction that is not really well known or documented, because when you're taking medication like that, they're not like, oh, when they test the medication in a lab, they don't prescribe 5 different medications to a person and see what happens. That's not how that works. It's when they say a medication is safe, they usually mean it is safe for the usage by itself. When you combine 4 or 5 different medications together, unknown reactions are bound to happen, which kill children all the time. This is not a isolated incident. So, because, ending my video here because I'm going on a rant and losing focus of my topic, but because how foster care agencies do not practice the least amount of meds for the maximum amount of benefits, and instead prescribe kids hundreds of meds because it might work, it results in inefficient use of money, because the state's now paying for 5 medications instead of just paying for 2 or 3. 2 or 3 medications is really the only thing you need. If you have ADHD and your anxiety and you have bipolar, there are meds that actually are designed to treat people with bipolar and anxiety. You don't need a separate pill for that. And because of that, kids tend to get severe mental deficiencies and executive functioning, because people's brains aren't designed to take in that many chemicals for corrective purposes. So it's dangerous in the long run. I'm finishing my video on these 3 points. It's dangerous in the long run. It's against current recommended practices in the field. It's really, really, really inefficient use of money. It causes the inner usage. It is mostly caused because state agencies aren't willing to advocate for the child. And 5, it is now making a pill epidemic among foster care people. Goodbye.